Here's for today. The next would be Mr. Edward Booty from Reach 52. Edward will be speaking on universal health coverage by 2030. How can insurers innovate to create health for all? Edward is the founder and CEO of Reach 52, a social enterprise building a brand new community-driven healthcare service model and supporting technology platforms to deliver healthcare services in low and middle income countries, integrating public and private sector. He has worked extensively in digital healthcare, patient access, insurance and health financing, business model innovation, patient journey design, business development, and creating new service delivery approaches across developed health economies in Europe and now Asian emerging markets. Prior to this, Edward worked for the UK National Health Service, NHS, and one of the world's largest consulting and tech organizations, Capgemini. He's a graduate from the London School of Economics. Welcome, Edward. The floor is yours.
Hey there, good afternoon. Can you hear me? Excellent. Let me just share my screen. Can we just do a quick time check as well, just on the length of the presentation, just in case anything's changed, that's all. Just to double check.
We have 40 minutes.
Cool, yeah, just checking. Oh, it's just, yeah, perhaps running behind or over. But yeah, well, firstly, you can see my screen as well, firstly?
Yes.
Okay, good. Just a bit quick tech check. Cool. Perfect. Let me just set myself a timer. We'll aim for perhaps 25 or 30 minutes for the slides. So I'm just timing myself this end. But yeah, well, firstly, yeah, well, thank you very much to the entire team for the invite, and yeah, nice to sort of virtually meet you all. Shame, of course, this isn't in person, but I hope you've had a fantastic few days and interesting presentations and aren't too zoomed out. I'll yeah, try and not bore you to death or anything with this one. But yeah, and thanks for the intro as well. So yeah, I guess I don't know if we are an unusual presentation for this forum, but certainly I would not say I'm from an insurance background, right? I yeah, worked in pharmaceutical companies, worked in digital health, worked in yeah, really enabling access to healthcare. Now we do quite a lot in the financial services space, but certainly isn't our background. So yeah, thanks for the invite, and yeah, I hope this is at least interesting or relevant or something slightly different at least. I guess, yeah, just before we sort of dig into everything, so yeah, as mentioned, I set up Reach 52. People always say, where does the name come from? 52% of our world can't access healthcare. So that's about 3.7 billion people, according to the World Health Organization and World Bank, that lack access to the essential primary healthcare services or healthcare services that the World Health Organization thinks people should have. Everything that we do is about reaching the 52% with the health services they need. And yeah, as mentioned, I mean, just as a sort of bit of orientation, really, we're 5 years old. We're in Philippines, Cambodia, and India, delivering healthcare access services. So really delivering, you know, services on the front line in more rural areas. Headquartered out of Singapore, very much started with, you know, digital health, telehealth, access to doctors, grew into medicines, and more recently now, yeah, it's been really getting into insurance and financial services, I guess, for fintech and so on. So we'll talk a bit about all of that today. But yeah, 3 countries and very much evolving into insurance as well. I guess we've done the introduction. Hope that all made sense. Yeah, feel free to fire questions in the chat as well. Try and leave at least 10 minutes for that at the end. And yeah, please do connect offline as well if you wanted to as well. And yeah, I guess we've already touched on this, but you know, the way that we see the world almost in this context is 52% of the world can't access healthcare. Ash mentioned that's 3.7 billion people. 1.7 billion people globally are purely cash-based and remain unbanked, making medicines ordering or insurance premium payment harder. 800 million people globally spend more than 10% of their household income on healthcare, many times, you know, pushing people into poverty. So a stat I'm sure many people have seen, 100 million people a year go into poverty due to their out-of-pocket healthcare costs. Something I didn't know till recently is quite a few of them are in America, which is somewhat alarming. I was associated with lower income countries. And then, yeah, on the flip side, you know, microinsurance is growing pretty fast, you know, much faster than pharmaceutical spending. So when we sort of looked at this problem, there's huge health access issues, lots of cash, very limited bankable or banked people, lots of people spending greater than 10% of their money on healthcare. And obviously poverty and sort of a big opportunity really of a relatively high growth market if you can build a model that can cater for some of these challenges and obstacles that you face. So what do we do and who are we? I guess to some extent described this already, but just to put it in my own words, what we're doing is we're going to sort of more rural areas, so non-urban areas, and we hire 1 or 2 people in a village to basically be a field force, an agent field force, like a microfinance institution or perhaps an insurance agency network would have. So we go into these communities, hire 1 or 2 members of the community to work for us. Sometimes we do that through NGOs. So to get scale faster, we also train NGOs on the ground to recruit this field force for us. And we also do quite a lot with social media, running ads to say, earn money today, support your community, get better health access today, and allow people to sign up to be an agent via social media channels. And then when we've built that field force, they're using a number of tech platforms we built to firstly collect data on healthcare needs or health and well-being needs, perhaps I'd say. So current diseases, income, livelihood, symptoms, diseases, symptoms of certain diseases, etc. Really train this field force directly or not, collect data. And then based on that, we're working with a range of global health firms, so big pharma companies, big med tech companies, starting to work with bigger financial institutions, banks and insurers, and local distributors to enable access to affordable private sector products. So we are effectively a marketplace and supply chain solution for social goods, affordable medicines and other things that improve health access. Very much focusing on a platform everybody can plug into. So that's your big pharma companies, but also your med tech companies for screening, but also your insurers. So the cost of that platform, I guess, to connect these communities is shared. And then really focusing on the distribution as well. So not just ordering the projects, but using this field force to actually deliver the medicines, deliver the services back to the rural areas. We're often compared to a Grab or an Uber in the sense that people with a car here in Singapore can do Grab food or Uber Eats or whatever. And they're just ultimately following instructions on a screen. We're doing something, I guess, relatively similar. People with a motorbike or people with a bike in a rural area become that access point for healthcare and can order and distribute private sector products. And then lastly, people often say, do you ignore the government? And the short answer is no. All of this is based on filling the gaps within government services. We work with government doctors. We do this in partnership with government and look for sort of private sector to fill the gaps in the publicly available, publicly funded services. All of this is driven by tech. So everything, all of the above services really is driven by, well, three main apps from a service delivery point of view. Reach 52 Access, which is really collecting the data on health needs, running local screening events with government, giving access to doctors, and really managing that connection to primary care services or healthcare services and delivering them at a more rural level. We've got Reach 52 Marketplace, where you're ordering discounted products or affordable products like heavily discounted medicines, scan the prescriptions, order the insurance, manage the customer onboarding, assign beneficiaries for life plans and so on, is all in Marketplace. And then because we're doing the supply chain as well, we've got Reach 52 Logistics, which is really tracking, from the pharmacy to the patient or to the village, really, for healthcare services. And then sitting behind this, we've got a platform called Insights, which is just looking at all the data from all the three main service delivery apps. We've got MediConnect, which is a health worker education app, really trying to improve the government health workforce. And we've got a lot of Facebook integrations as well. So really automated chatbots and so on for Facebook Messenger. So you can reorder your medicine via Messenger. You can do a COVID symptom check via Facebook Messenger, and all of that is integrated to our core database effectively. And then, yeah, what we're really trying to drive, we're very proudly a social enterprise. We're revenue generating. We make money from insurance sales commissions and delivery fees on the medicines, as well as some B2B services. So pharma companies would often pay us to do screening campaigns or train health workers, for example. But yeah, what we're trying to do is really just drive from awareness of health issues through, sort of just education, but also data collection, flagging risks, also running programs, through to making products available, and obviously looking to increase the affordability of healthcare as well. And that's partly through getting more affordable products. We work with pharma companies. They give us between 20 and 90% discounts on the products, but also lost time and lost travel. So bringing it to the village versus travel 2 hours to the nearest town. And of course, insurance plays a huge role in that, in terms of improving the financial resilience as well. So I hope that makes sense. I guess, the recap is we go to rural areas, train 1 or 2 women, they collect data. Based on that data, we run services with government, public health, screening, access to doctors type stuff, and then they facilitate access to a marketplace of services. I think this is actually really important just to say that we started off with medicines. We now derive significantly more of our commissions from insurance. We're like a health company that makes more money from selling insurance. So yeah, it's been quite an organic transition, but I guess that's perhaps why we were asked to speak today. And yeah, I guess I've sort of mentioned this, and I guess there's some on the call that like tech and some that perhaps don't, so I'll go over it really quickly. But yeah, everything we do is based on these offline first apps. So Reach 52 Access, collecting the data, running the programs, marketplace and logistics, order and deliver products. And then, yeah, as mentioned, sort of integrating to that back end is MediConnect to train the health workers, and Facebook to really provide that direct to customer interactions through chat. Often Facebook pays for the data with the telcos. If you have a phone and you're connected to the internet, you're going to use Facebook. So we've just found that as a much more effective channel to engage in populations versus try and build a customer facing app in the short term. Just worth noting in terms of learning, everything works offline. Very old versions of Android just to make it more accessible, which is a real pain to engineer for, frankly. We made the user interfaces incredibly basic. So a lot of it has been sort of designed for digitally harsh environments, if you will. Certainly not, Apple or iPhones or anything like that, which has actually been probably one of the biggest challenges we faced, to be honest. Deliver quite advanced tech, but on very low spec phones and very outdated versions of Android and so on and so forth. And then, so just in terms of where we are, this is actually just from our pitch deck, although I know we're not pitching here, but we're in about 1,000 communities in the Philippines, Cambodia and India. We work with about 20 big global businesses. We offer about 750 products now. So that's medicines, and I think about 15 or 20 of them are insurance plans. And we've got quite a lot of data, about 4 million unique records in our database that are giving, that real insight to a population that governments and private sector struggle to serve. And we're just in the process of launching in Indonesia as well. So that'll be our 4th country coming up this year. And then, I guess we put this slide in, because, distribution's hard, right? And I guess, with all the insurers on the call, we all know the value of distribution partners and, bank assurance and everything else. Our whole mission is how do we connect 250 million people to healthcare by 2030, really looking to strengthen the government health systems and improve financial resilience. It's never going to be free. Governments aren't going to pay in the short term, right? Many governments won't, I guess I should say. But we need to make it more affordable and more accessible. As mentioned, we actually don't really implement our service alone. We work with NGOs and microfinance institutions to implement the Reach 52 model for us. So in India, we have 2 massive NGOs implementing this sort of health access service, hiring the women, training the women in the communities, handing out the phones and this sort of thing. So yeah, we also use distribution channels to get faster scale. And we also are starting to work a bit with village stores. So existing village stores, equip them, they can become access points for services. We're just piloting that and it's going pretty well. And then, yeah, also as mentioned earlier, we do a lot with digital, but purely through self-service automated chatbots. So we run Facebook ads for, say, COVID or financial literacy. You can get information, but also share additional information to sign up to broader Reach 52 services if you wish. And we are going to build a customer-facing app at some point. And yeah, in 3 countries, and very much interested in the 4 on the screen now: Indonesia, Vietnam, Myanmar, and Bangladesh. So we're just in that process of scaling up now. But again, really not just going it alone, but working with those NGOs on the ground and driving scale that way. And yeah, Indonesia's just coming online early next year through that model. And then yeah, again, this slide's a bit of a sort of pitch slide for us in a way, if I'm honest. But I sort of liked it when I looked at it with this conference presentation in mind. As mentioned, we started off as a health company, and we're training 5,000 health workers for Johnson & Johnson and doing insulin with Biocon for $3 a month, where normally it's $15 a month, 80% savings on insulin for diabetics. And we're doing hepatitis B screening and treatment with Gilead. And we do ultrasounds, so pregnant mother ultrasounds with Philips. But very much, yeah, started off as a health company, medicines, screening. But now, like when we look at our slides, like we've got sort of 5 or actually 6, I think that's just a cut off a logo there, sorry, there's 6 insurers that we work with, obviously Allianz being the big brand, and there's a little case study of what we did with them later, so I won't go into it now. But yeah, we also work with the national insurers, and we're looking to work with some of the bigger global brands as well. And I've missed one from India here, apologies. And down here, working with UNICEF. This is actually a project with UNICEF Innovation, very much in the fintech space. So looking to build a health wallet and points. So as you refer a friend for insurance, you get points. Points mean discounts. As you keep buying your medicines, you get points. So trying to use sort of micro financial incentives to promote health seeking and promote peer-to-peer or customer-to-customer referrals in low resource settings, funded by UNICEF. We're doing a project with Pfizer, which is all about alternating payments for health workers. So if a health worker travels further to serve somebody, or if one of our field force members travels further to collect a premium, they get a higher commission, funded by the Pfizer Foundation. We got funding from the DBS Foundation. We're looking at doing insurance claims or insurance access in India, which is where we launched in India earlier this year, and also building claims processing. So even as we look at and then UNCDF actually, sorry, was a whole fintech program. Yeah. So even as we sort of look at our logo slide, if you will, at least half of it now is coming from fintech or financial services, and this just wasn't deliberate. It's almost like we've been pulled towards it or quite organically grown into a sort of half fintech, half financial services, half health business. And really pretty much every logo on this side is within the past 12 months, whereas prior to that, it would have been pretty much all pharma and medtech logos. So it feels like there's some change happening, I guess. And yeah, with that in mind, yeah, we've won a lot of awards, and I mean, pretty much all the awards have been coming from fintech as well. We've got this award called Inclusive FinTech 50, where we're improving financial resilience. That was with Visa and BlackRock as the sort of funders. And yeah, just a lot of what we've done again is coming down to this financial inclusion and financial literacy as well, which again, we never really planned. It's just been an interesting byproduct really of health access coming into that financial services space. And then yeah, with that in mind, yeah, as an organization, we've just started to shift our focus, right? We're very proudly a startup and a social enterprise. We're about 50 or 60 people in the office now, just to be open, and about 500 or so that work in the field, just going up to that sort of Series A level of financing in investment terms. And yeah, if you look at our, almost like, investor data room or something, if you look at our financial model, a huge amount of the money we make comes from insurance. So like we've sort of organically had this, and when I say insurance, that just again to be really transparent, it's commissions on the plans that we sell, as well as other services, because we get the commissions on the marketplace, but also claims processing within a lot of our insurance contracts. Now we're getting a small fee that claims do the claims processing, and also helping manage the disbursements. So as payments need to be made, people might be unbanked, shipping checks around, whatever it might be, not convenient. But because we've got that integrated platform to serve the community for all their needs, we just have that natural ability to sell the plan, get the claims documents, take photos of them, manage the payouts, and we've already sort of got that infrastructure or platform paid for, which obviously means we don't have to levy the cost onto a single partner or anything. So we can keep our costs pretty affordable, but still sort of comfortably break even, I guess. So yeah, with that in mind, you look at our data room, you look at our financial model, and we're becoming an insurance company. We make 4 to 5 times more in insurance now than we do in medicines, and that just wasn't the plan. But it's led to quite a big shift in focus for us, and I guess that's what we're going to talk a bit about now. And I guess, yeah, with that in mind, we sort of stumbled across this, but when you look at product distribution, so whether it be Unilever with their sachets of firstly training women, secondly sachets that are more suitable for village stores. You look at Coca-Cola and how they penetrated Liberia and Swaziland, and obviously you can get a cold Coca-Cola in any of the villages, and all of these cliched things almost. People have done this, right? People have changed their product into what is equivalent of microinsurance, i.e. lower cash outlay, smaller chunks, more accessible, available locally, and made it work into hugely profitable businesses, especially Unilever in India. It's crazy how much they ship and make, and how they've just unlocked this part of the market. So it sort of works, but microinsurance is somewhat, not quite a dirty word, but it's had its financial sustainability challenges within the insurance space, and obviously aware of the risks and anti-selection and fraud, of course, that can happen. But this has been cracked in other areas. And I guess we're just trying to take these concepts and bring it to insurance. So we did have all of our work externally validated. We had like a social impact audit about this time last year. And yeah, I guess what we're doing is taking some of these last mile supply chain models and building it into insurance access and medicines access. And we're starting to achieve pretty good impact. So for every dollar we make as a company, we save poorer people about $2.10 in their health access costs. So that's savings on medicine, saving on travel as a result of being insured, perhaps saving on a hospital bill or medical reimbursement. And yeah, it's great because we're really proud of this, right? We are a startup, we're trying to grow really fast, all that cool stuff. We use digital tech and all this buzzword sort of thing. At the end of the day, we make money and we save poorer people money, and it's sort of an integrated model. When I learn from some of this stuff that works, but admittedly, insurance has its challenges here, and certainly struggle in many ways. And I guess, yeah, the more that we look at it, there's a huge market here. It's fragmented and bitty, and you can't go and get $1,000 a year premium, or I think my life insurance here is like $3,500 a year or something. You just don't get that individual premium ticket. But there's a huge protection gap of $1.4 trillion that people are spending out of pocket, right? This is cash people spend on their healthcare. Less than 5% market penetration, according to Swiss Re, I think that is. Oh no, #1, sorry, Insurance Business Magazine. So yeah, hugely untapped market. Double clicked, didn't mean to. And yeah, huge opportunities. Estimated 1.5 to 3 billion policies are left, according to Insurance Business Mag again, and estimated sort of 30 trillion spending power of consumers. So that's obviously not all in health, or on insurance, but a large amount of combined spending power. So there is money here, and that's actually been one of our learnings. I mean, even when we went in, so this is actually in Cambodia, we had two insurers, a very affordable, as in cheaper, but more complex plan, and a very simple but more expensive plan that actually offered full real cost of hospitalization. And people are buying the more expensive plan. You know, it's double or so the other plan. I can't remember the exact numbers, but it's, you know, 100% more expensive sort of thing, or 2 times more expensive. And people buy that, and they can find money for protection as long as the value proposition's there, as long as it's simple. We're certainly seeing the conversion. And in some of our villages in the Philippines, you know, average village is maybe 1,000, 1,200 people, something like that. 30% conversion. So yeah, I don't know if that's high or low. For me, it seems quite high. You know, we've been to a village and 30% of people have chosen voluntarily to buy insurance because it's communicated in a way that's understandable and the value's clear. So yeah, notwithstanding all the problems, there's clear need here, and our view is if you get the operating model right, there's huge opportunities as well. And then yeah, as mentioned on the opening slide, 8.2% market growth over the past 4 or 5 years or so. Huge opportunity to penetrate emerging markets, hugely untapped opportunity as well. But you really need innovative models to combat traditional barriers. 5 minutes left, so I'll just go a little bit quicker. But I guess just, yeah, with the relatively untapped point as well, we just did a pretty big survey of insurance needs in Philippines, and actually in India as well. We ran it across both countries, and you know, a lot of, I think it was 78% of people had never heard of insurance. So there's just a lack of marketing basically. And yeah, when we actually just start to offer it, obviously it's part of a more integrated service with more value than just insurance. You know, you can get a free diabetes screening funded by our pharma partner, or yeah, your insulin for $3, not $15. We get the conversion. Yeah, just because we're often the only person offering that insurance service in the rural areas. So hugely untapped market. Yeah, for sure. And then yeah, when we look at financial resilience, we also just see there's a huge need. So as mentioned, 65% of the global health protection gap, so people that, you know, don't have suitable financial protection from public or private insurance, I guess, government funded services, 65% of it's in lower income countries, right? So beyond the business opportunity, albeit with challenges, albeit harder to access, there's a social problem here, right? And we don't do CSR as a company. We don't really take grants. We're determined not to, right? Because we want to build a business model that creates health equity. But this is just bad stuff, right? You know, if we really think about it, the amount of people that are in the most vulnerable position globally, especially with COVID at the moment, are also, you know, really unprotected. And yeah, in low middle income countries, nearly half of all public health expenditures coming from private sources. So just a real sort of social impediment here as well. And that's why, yeah, we're really just determined to offer insurance as part of a much more holistic health solution, really focus on the customer experience, promoting loyalty, really increasing the number of customer touch points that we can manage. So yeah, going from the sales to the distribution, and you know, marketing effectively, or marketing and then sales, I should say, and then the insurance claims processing, managing the payouts. If it's not covered by insurance, offer something either for free or at a lower cost from another partner, and really just focusing on, yeah, other ways that we can make small amounts of revenue in a sustainable way, i.e. by us helping process the claim. It's cheaper than if the insurer did it themselves, and also increasing that customer value to improve loyalty. And then of course, yeah, but beyond that, you know, we've got a lot of data, pretty unique insights, and all of our plans, we hold a group plan. So yeah, we're really promoting to everybody in the community. At the moment, it's not compulsory insurance, of course, because we're just a marketplace, but we look to obviously get the conversion. We hold one single plan as Reach 52 and try and lower that anti-selection bias as best we can. And then, yeah, as mentioned, we're doing something pretty cool with Allianz, very different to this, but we just sort of thought we'd share this case study. But what Allianz offered to do with us was basically every time they sell a plan to a wealthier person in the Philippines, they donate a plan to one of our poorest community members. I don't know why, I just really love this project, to be honest. Yeah, so it was actually them approach us about it. They want to do something just good. It's effectively part of their high net worth plan marketing to some extent. So yeah, by buying an Allianz insurance plan, you also sponsor a plan for a poorer Filipino. And yeah, it's just good. So yeah, there's very low insurance penetration, huge disparity amongst customer groups, sort of need digital health access as well. Obviously, what we're doing is collecting and analysing the health data via our field force, and then giving these free plans away. Yeah, 200 or 300 in the first month, I think, and then continuing to grow. And then, yeah, for every purchase of an Allianz Well plan, members of rural villages receive an insurance plan. They also get some additional top-up benefit against COVID-19 hospitalisation. So that's obviously just a bit topical at the moment. But yeah, really great product, and sort of showing how we are getting some instant payment by tagging this on to a more expensive plan for people that can afford it, I guess. And then, yeah, just scrolling forward a little bit more. So yeah, as mentioned, we're sort of really moving into insurance with DBS. So this is doing the claims processing, collecting documents, managing reimbursements and disbursements. We've built a lot of chatbots on Facebook for financial literacy. We're doing income assessments for differential medicine pricing. So a vaccine can go from $0 to $50, depending on your income. And there's different pricing tiers within that. And also, as mentioned, building the health wallet and points. So really looking to refer someone for insurance, get discounts, and also integrate M-wallets as well. And then, yeah, so partnering with insurers, again, as mentioned, we do a lot around financial literacy. I do a lot of market research, really support on distribution, marketing and sales, managing the plans once sold, of course. And we're looking to build this digital ecosystem. And I've loved, what Prudential and Pulse have done, for example, and we're really trying to think about how we build that for these, underserved, low to middle income consumers, but take that same ecosystem approach. And yeah, what's the value here? I mean, yeah, again, a lot of insurance and indeed medicines and all services, anything is geared towards higher income people, but we do see value here. And when you boil it down, definitely accessing new underserved markets, expanding the portfolio of products offered, offer more innovative plans in different ways, ultimately increasing sales premiums. I do see this as competitive advantage, especially in medicines as well. Brand loyalty counts. Asian GDP is growing very fast compared to Europe. Having brand awareness now will potentially pay off in the future, especially as I think it's 70% of middle income people will be in Asia by 2030. Obviously supporting public affairs and corporate communications, including internal employee benefits as well, and obviously starting to contribute to social and sustainability goals. And when you look at all other sectors, that push towards ESG and sustainability and carbon emissions, that whole spectrum of being a socially responsible business, I feel is more actively executed in pharma companies, but by doing programs like this, I do think these 4 benefits are what can be gained. So yeah, a bit over. That was 32 minutes, not 30 like planned, but hope that was at least somewhat interesting, and I very much welcome any questions. And comments and feedback as well, of course, would be welcomed, even if offline. Thanks for listening.
Yeah, thank you, Albert. Yeah, thanks for sharing how the insurers can actually help to innovate and create and achieve the 52% universal healthcare coverage. We do have one question. It's related to, I think, your earlier slides on 8.2% CAGR. Would you be able to share with us the size of micro insurance market in terms of premium amount in Asia?
I must admit, I don't know that directly, but I would definitely, size of micro insurance premium amount. I don't know directly, no, just know the growth rate. Afraid not, but would like to follow up on that. If that person would like to message me, I would definitely go and ask and look.
Yep, sure. If you can probably flash your slide on your contact information, the last bit, then I think he can.
Bear with me, I'll just get back to that. That's a fair point. Yeah, I'll go back to this one. That's one way of doing it.
I think your contact is at the last slide.
Yeah. Oh, was it? Okay.
Or the first slide.
Anyway, yeah, I'll leave that one up.
Yep. Yeah, I think that's the one question that we received.